Hello, my name is Neil Ward. I'm doing my NG tube insertion video. I enter the patient's room and knock. I provide privacy by closing the curtain. I introduce myself. I say my name is Neil. I'm here to do an NG tube. I explain to the patient why the doctor ordered an NG tube, and that'll relieve pressure they're feeling in your stomach, and we're going to suction some of the bypass. We're going to suction some of the excess fluid in their stomach. I explain to the patient it might be a little bit uncomfortable. We're going to insert a tube through their nostril, through the back of their throat, all the way down to their stomach. I say it takes about 5 to 10 minutes, and we'll definitely have, we'll make it so that it's least intrusive as possible. I check the patient's wristband. I perform 2 IDs. This is the right patient. I have the right order. It's the right time. And I have my supplies. I have my Emerson bin and lube. I have my syringe. I have my nasogastric tube. I have a tub of water to make my tube more patent. I have my chuck. I have my patient. I have some pre-cut pieces of tape already, my hand sanitizer, my sharps, and a trash container. I perform hand hygiene. Patient says they have no allergies. They say they're ready to go. I move the bed up to a good working height, and I explain to the patient that when I first insert the tube, I'm going to have them put their head back or flex back, and then once it hits their gag reflex, then I'm going to have them cut forward, and I have a cup of water with a straw, and they'll take little sips. As they take sips, peristalsis will help bring the tube down into the stomach for a correct placement. After explaining the procedure, patient agrees. I set up my chuck, which isn't going to want to stay here at the moment. I'm going to take my tube. Actually, before I take my tube, I'm going to put it in the water and let it get soft. I'm going to take my pen light and I'm going to look in each nostril, see if there's any obstructions, if there's any redness or irritation already existing. I don't, looking at the left and the right side. I explain to the patient I'm going to plug one side and have them breathe through the other side. And I'm going to do both, and I'm going to choose which nostril has the better airflow. It seems that it's the patient's right or my left, this near one, has the better airflow, so that's the one we're going to go with. I have my tube softened. I'm going to measure. I'm going to come from the earlobe to the nose, all the way down to the xiphoid process, which, according to this, is about 55 on my rated tube. I'm going to take a piece of tape. I'm going to put 55. I'm going to put the tape at 55 so we have a marker, a place where we know where to stop. I'm going to tell the patient I'm going to put some water-soluble lube on the tube to help things go a little bit better. Patient is ready. I tell them to put their hand up if they feel any discomfort or anything extreme or something that if we need to stop. Patient agrees. They understand. And we begin. The tube in. It's going smoothly. Patient gags. Okay. Now we move the patient up, and I explain to the patient now they're going to put their chin all the way forward, and I have a cup of water, and every couple inches they'll take a sip, and peristalsis, or their throat muscles, will do the rest and pull the tube down. We do it. Going smoothly. Patient's not having any problems. Sips of water, sips of water, sips of water, sips of water. Alright, and now we've reached our point where the xiphoid process should be reached. I clamp my tube, take the cap off my needle, then I'm going to pull about 5 to 10 milliliters of gastric juice into my tube. There we are, 10 milliliters. I've unclamped. I pulled my gastric. I reclamp. I put my gastric juice into my Emerson bin. I notify X-ray that I am requesting an X-ray for tube placement. X-ray says they're on their way. In the meantime, I take a pH strip and I test my gastric juice, and it is between 3.5 and 5, so it's normal. It's exactly where we want it to be. Now, X-ray has come. They confirmed placement. It is in where it's the right place. The patient says they're comfortable. Now that that has occurred, I'm going to take a piece of tape and I'm going to secure it in a way that is least obstructive to the patient onto their nose. If I want, I can also take a little mark on the tape so we know if the tube is moved at all or not. Everything is go. I plug into suction. Suction as I'm coming, I'm seeing return from the suction line. We're not having any issues there. I'm going to tell the patient that they need to stay in a sort of elevated Fowler's or 35 to 45 degree angle while the suction is in, just so that there's no return or nothing that they gag on or choke on. The patient understands and agrees, is able to verbalize that my instructions back to me. I then lower the bed. I thank the patient for their help. I give them their call light. I'm going to be checking on this suction tube at least every 2 hours to make sure that it's patent and that it's still functioning, and that the NG tube hasn't migrated in or out any further than it already is. And I remove my gloves. I remove my supplies. I perform hand hygiene. And I thank the patient for their time, and then I go document the procedure done, what time it was done, the number that on the tube that we stopped at, which is 55, and how the patient tolerated it, and anything else that would be pertinent to the procedure. And that's it. I open the door, and I thank the patient again for their time and their help, and that's all.